You're here because you want to get smart fast. You want that core knowledge, none of the fluff. And that's what we do.
Exactly.
So today we're digging into something that's, well, thankfully not common, but it's really important if you care about your pets. Dogs and cats specifically.
Mm-hmm.
We're talking about tumors in the heart muscle itself, myocardial tumors. We've gone through the medical literature, the research to pull out what you really need to know.
Right. We've looked at the medical texts to sort of synthesize the key points about these tumors, how they might present, how vets diagnose them, and what it all means.
Yeah, making it accessible.
Our mission really is just to break down this, quite complex info.
Okay, so heart muscle tumors.
Hmm?
The first thing that really jumps out from the sources is just how rare these actually are.
Yeah, remarkably so.
Like for dogs, the number is around 0.19%, so less than one dog in every 500 roughly.
And for cats, even less common. About 0.03%. Tiny numbers.
So really uncommon, but I guess still significant when it does happen.
Absolutely. And what's kind of fascinating, despite the rarity, is the sheer variety of tumors that can actually develop in the heart muscle.
Oh, really? Like what?
Well, the literature lists quite a few. You've got things like hemangiosarcoma, which is a tumor of blood vessel cells.
Okay.
Then, kind of surprisingly, ectopic thyroid carcinoma, basically thyroid tissue growing where it shouldn't in the heart.
Wow, okay.
Lymphoma, of course. And then tumors from muscle tissue itself, like rhabdomyoma and rhabdomyosarcoma.
That makes sense, muscle tissue.
Right. But it doesn't stop there. You also see things like thymoma, mesothelioma, chondrosarcoma, which is cartilage.
In the heart?
Yeah. Osteosarcoma bone, fibrosarcoma, myxoma, myxosarcoma, lipoma fat tumors.
It's quite a list.
And even peripheral nerve sheath tumors and granular cell tumors. It just shows how complex that heart tissue is.
Definitely. A real rogues gallery, as you said. So who gets these? Is it mostly dogs or cats too?
It can happen in both, but the sources are clear. It's generally less common in cats. For dogs, it can occur at any age, really. But there seems to be a higher incidence, sort of a peak, between 7 and 15 years old.
So middle-aged to older dogs mostly.
Mostly, yeah. And here's something interesting, maybe a bit unexpected from the data.
What's that?
There's a suggestion, a potential link to neutering, possibly a higher incidence in neutered animals.
That makes stop and think, doesn't it? Any idea why?
Well, the why isn't clear from these sources. It's more of an observation, a correlation in the data that, probably needs more research. Hormones do influence a lot of things.
Yeah, fair enough. Interesting, though. What about breeds? Does it mention specific dog breeds?
It does. Their research points to several breeds that might have a higher predisposition.
Like who?
Okay, so the list includes Salukis, French Bulldogs, Irish Water Spaniels, Flat-Coated Retrievers, Golden Retrievers.
Goldens, okay. Common breed.
Boxers, Afghan Hounds, English Setters, Scottish Terriers, Boston Terriers, Bulldogs, and German Shepherds.
That's quite a mix. Different shape, sizes.
Exactly. It's a diverse group, which makes you wonder about potential shared genetic factors, maybe.
Right. Identifying those breeds is probably a big first step for researchers looking into the genetics of it.
Precisely. It allows for more targeted studies, potentially finding specific genes or pathways involved. Could help down the line with, screening or understanding risk.
Okay, so let's shift gears. For a pet owner, what are the actual signs? What might you see if, heaven forbid, your pet was developing one of these?
The signs can be quite varied and often pretty serious, unfortunately.
Right.
Well, things like sudden collapse, which is obviously terrifying.
Yeah.
A swollen abdomen, maybe from fluid buildup. A noticeable drop in exercise tolerance, getting tired really easily, maybe seeming short of breath.
Okay, difficulty breathing maybe?
Yes. Dyspnea. Also, loss of appetite, maybe vomiting or diarrhea. And tragically, sometimes the first and only sign is acute death.
Wow, so it can come on very suddenly and be very severe. Sounds like it really impacts the heart's function quickly.
It often does, but the challenge here is that none of these signs are unique only to myocardial tumors.
Right. Other things could cause them.
Exactly. The texts list several differential diagnoses other conditions vets need to rule out. Things like idiopathic pericardial effusion, which is fluid around the heart without a known cause. Pericarditis, inflammation of that sac around the heart. Different types of cardiomyopathy, just general heart muscle disease, regular heart failure, valve problems.
So lots of possibilities.
And even tumors located nearby, like at the base of the heart, not strictly in the muscle. It makes diagnosis tricky.
So how do vets figure it out then? What are the diagnostic steps?
Well, they start with the basics. Blood work can sometimes give clues.
Like what? Anemia.
Yeah, the sources mention anemia, low red blood cells might be present sometimes. But a potentially more specific marker is something called cardiac troponin I.
Troponin. I've heard of that in human heart attacks.
Exactly. It's released when heart muscle is damaged. The research highlights that increased levels are often seen, especially with cardiac hemangiosarcoma.
Oh. And interestingly, it suggests it might be useful for other types of these heart tumors too. Not definitive, but a strong clue.
So high troponin levels would definitely raise suspicion.
It points towards heart muscle damage, yes. So in the right context with those clinical signs, it adds weight to the possibility of a tumor.
Makes sense. What about looking at the heart itself? Imaging.
Crucial. Chest x-rays or thoracic radiography are often a first step. They might show like a big round-looking heart, what they call a globoid heart shape,
Suggesting fluid?
suggesting pericardial effusion, yeah. Or they might actually see a mass near the upper chambers, the atria, or even, sadly, signs of spread to the lungs metastases.
Okay. But x-rays aren't perfect for seeing inside the heart muscle itself, right?
Right. That's where echocardiography comes in, an ultrasound of the heart. The sources really emphasize its value here.
Because it can see the actual tumor.
Yes, it lets you visualize the mass within the muscle, see its size, location, how it's affecting function. The research mentions it has a high positive predictive value, meaning if they see a mass on the echo and the symptoms fit, it's likely a tumor.
There's a strong likelihood, yes. It's considered a key diagnostic tool here, a real game changer for finding these.
Okay. Are there other, maybe more invasive procedures they might do?
Sometimes they might perform pericardiocentesis using a needle to draw fluid from that sac around the heart.
Why do that?
Well, especially if lymphoma is suspected, they can analyze the fluid for cancerous cells. Although, interestingly, the sources say just looking at the fluid cytology isn't always great at telling neoplastic, cancerous effusion apart from non-cancerous causes.
So it's not always clear-cut, even with the fluid.
Not always. Then there's the ECG electrocardiogram, measuring electrical activity.
What does that show?
It can be variable. Sometimes it's normal. Other times you see arrhythmias, irregular heartbeats, or specific patterns like electrical alternans or small complexes, especially if there's significant pericardial effusion.
Lots of potential electrical signs then.
Yes. And ultimately, if needed and if it's feasible and safe, a surgical biopsy taking a small piece of the tumor itself is the most definitive way to get a diagnosis.
Right. Getting the tissue examined.
Exactly. So it's really about piecing together all these clues, the history, the signs, blood work, imaging, maybe fluid or tissue analysis.
Especially since they're so rare, you really need that thorough workup.
Absolutely.
Okay, so let's say the diagnosis is confirmed, a myocardial tumor. What happens next? What are the treatment options?
Well, the primary goal, if possible, is surgery, to physically remove the mass.
Makes sense. Cut it out.
Get rid of the source of the problem if you can. Now, if fluid buildup, that pericardial effusion, is a major issue causing problems.
Like compressing the heart.
Exactly. Then a procedure called a pericardectomy might be done. That's where they remove part, or sometimes all, of that pericardial sac around the heart.
To relieve the pressure?
To relieve the pressure, improve heart function. Even if the tumor itself can't be completely removed, it can be palliative.
Okay. The sources also mention the difficult conversations around sudden death being a risk.
Yes, unfortunately, that's a harsh reality with these conditions. Complete surgical removal isn't always possible, maybe due to the location or spread.
So then it's about managing symptoms.
Managing symptoms, improving quality of life. Palliative care becomes the focus. Pericardectomy can still be part of that.
What about medications?
Medications definitely play a role. For managing those dangerous arrhythmias, those irregular heartbeats, the literature lists specific antiarrhythmic drugs for dogs, things like lidocaine, often given as an injection initially, then maybe oral drugs like mexiletine or sotalol. The sources provide typical dosages and how they're given.
Okay. And chemotherapy, is that used?
It depends very much on the type of tumor. The sources specifically mention chemo being part of the plan for lymphoma and hemangiosarcoma.
Right, those specific types.
Yes, but it's important to be cautious. The texts highlight potential side effects, toxicities.
Like what kind of side effects?
Oh, the usual concerns with chemo. Digestive upset, suppressing the bone marrow, which affects blood cells, and potentially even cardiac toxicity with some drugs.
So it's a balancing act.
Very much so, weighing the potential benefits against the risks. For other tumor types, the effectiveness might be less clear, and the side effect profile needs careful consideration, usually with an oncologist.
Got it. So finally, what's the outlook, the long-term picture after diagnosis?
The emphasis is really on ongoing monitoring. Close follow-up is key.
What does that involve?
Things like serial echocardiograms to see how the tumor is responding or if it's recurring. Chest x-rays, maybe abdominal ultrasounds too, to check for metastasis, for spread. ECGs to monitor how well the antiarrhythmic drugs are working. And regular blood tests, especially CBCs, to watch for those chemo side effects if that's being used.
And the prognosis overall?
Unfortunately, it's generally described as guarded to poor.
That's tough.
It is. These are often aggressive tumors. Even with treatment, long-term survival can be challenging. It depends on the tumor type, the stage, whether it's spread, the individual animal's health, many factors.
But the bottom line is often difficult.
The bottom line often reflects the serious nature of these conditions, yes. Guarded to poor is the typical language used.
Okay, so let's try to bring it all together. What we've learned today is that these primary heart muscle tumors in dogs and cats, while rare,
Very rare.
can present in many ways, often with pretty serious signs. Diagnosis isn't straightforward. It takes a combination of tests.
A puzzle to piece together.
And while there are treatment surgery, medications, the long-term outlook is, well, often challenging. It's a heavy topic, but important to understand.
Absolutely. Awareness is key, even for rare conditions. For owners and vets, recognizing potential signs early can make a difference in getting that diagnostic process started.
Right. And that kind of leaves us with a final thought for you, the listener, to mull over. Given that the causes, the actual triggers for these rare tumors, are still unknown,
A big question mark there.
what areas of research do you think might be most fruitful? Where should scientists be looking to understand why these happen, and maybe, just maybe, find ways to prevent them or treat them more effectively down the road?
Yeah, think about genetics, environment, cell biology. It's complex.
It really is. Something to ponder about the ongoing journey of science. Thanks for diving deep with us today.